I'm in an unusual position as a state senator, a doctor, and a former director of public health that when our legislature met on March 16th to discuss what happens in an era where we have to have social distancing and only allowed to meet in small groups, what do we do about the continuity of care of our government, and are there things that need to be made on a policy decision that can be suggested? So on March 16th, we did the most important thing we could do as a legislature, and that was to ensure the continuity of our government when we can't meet together in a public forum. But there were other suggestions I made. We did approve for $525,000 to go to the state hygienic lab for increased testing. There may be more money that needs to be allocated in the future, but we have the resources now to be able to do that. But there are other things that we can do as legislators and policy decisions that we should have forethought rather than reaction to a crisis. One of them is that giving increased funding to the Iowa Department of Public Health, especially when it comes to looking at how we track, monitor, and detect infectious diseases. We already have the possibility to do that, and we have the resources to do that, but we may need increased funding in that direction. Another thing that I'd like to see happen is that we anticipate the healthcare system could be severely stressed if, in fact, the crisis is bigger than we anticipate. So there are avenues that we could have the Iowa Department of Public Health, which has a volunteer provider network, and the boards of medicine and nursing to come together to see if there are retired physicians and nurses who would be willing to volunteer in order to reduce the stress on the personnel in the healthcare system. And this is something that they have to look at for licensure requirements and certification. Similar things were done when we had Hurricane Katrina, and this is a conversation that we should be having now. We also should look at our National Guard and our reservists to see if there are assets, such as ventilators, within our military system that could be determined now to be functional and if they would be available for use in healthcare facilities. And then the last thing I'd like to address is telehealth. So we could temporarily expand coverage and have insurance companies who do not currently cover telehealth to cover telehealth, and then also talk about the reimbursement issues with telehealth. But telehealth is a way to expand services to individuals, especially mental health services at a time of increased anxiety and increased stress that may need to be more available than they currently are. This allows us to continue social distancing. It allows people to have remote access, and is a policy issue that needs to be addressed at this time.